Most doctors I know don't lack knowledge, they don't lack competence, but many still say, I just don't feel confident enough. In this video, I want to explain why confidence isn't something you wait to magically appear. It's what you become when your thoughts, your words, and your actions stop contradicting each other. Building confidence is simple. You decide clearly, you speak assertively, and then you follow through. You do what you say you'll do. You don't need to be perfect, but you do need to be consistent. Now, simple doesn't mean easy. Confidence doesn't come from knowing all the answers. It comes from trusting how you'll respond when you don't know the answers. Before we go any further, let's be clear about what we even mean by confidence, because we often confuse it with other things. The word confidence comes from the Latin confidere. Con means together and fidere, to trust. So confidence literally means to trust. Trust yourself, your judgment, or how you'll respond. It isn't a personality trait, and it isn't knowing how things will turn out. It's built by how we think, how we speak, and what we do repeatedly. Let me show you how doctors actually build confidence. Hi, I'm Dr. Finbar McGrady. On this channel, I share mindset tools and real stories that help doctors grow, respond, and thrive. Medicine is a strange profession when it comes to confidence. We're trained to be careful, to acknowledge uncertainty, to work in probabilities and not guarantees. And that's a good thing. But somewhere along the way, careful thinking gets confused with a lack of confidence. I often hear doctors say, I don't feel confident yet. But what they usually mean is, I don't feel certain. And those two things are not the same. If confidence required certainty, none of us would ever feel confident, because medicine doesn't work like that. Where confidence really breaks down isn't in our knowledge. It breaks down in the small moments, in how we speak, and in whether we follow through with what we said we would do. We soften our language to avoid discomfort. We apologize when we don't need to. We hedge our bets to protect ourselves. And over time, that chips away at something important. Trust in ourselves. Let's start with language in the consultation. Listen to how often we say things like, I'm sorry, but, or I might be wrong, but, or I'm not sure if this will help. Those phrases feel polite and they feel careful, but they actually start to undermine you. Not because you're wrong, but because you're signaling doubt where clarity is needed instead. Patients don't expect certainty all the time, but they do want clarity. Assertive language doesn't mean certainty. It means standing clearly inside uncertainty. You can say, based on what I see today, this is the most likely explanation. Or, this is the plan I recommend. You're saying similar things to what you did earlier, but now the patient has clarity and you haven't undermined yourself by apologizing or making excuses. Another example is on follow-through. When you tell a patient you'll do something like phone them with results and you do it, rather than leaving them to chase you, that really makes a difference. The patient trusts you more, but more importantly, you trust yourself more. Confidence grows when your actions match your words. Medicine doesn't offer certainty. There's often detective work involved before a diagnosis becomes clear. Confident doctors aren't the ones who know how things will turn out, but they are the ones who trust how they'll respond when they don't. Earlier I said that confidence literally means to trust. Trust yourself, your judgment, and how you'll respond. So from that idea of trust, two different things can show up. Firstly, certainty. Certainty is what confidence feels like on the inside. The question feels answered. Doubt is minimal. You believe something is true. You can be certain and quiet, certain and humble, and you can even be wrong and still feel certain. Certainty is about how sure you are. The second thing is assertiveness. Assertiveness is confidence expressed outwardly. You state your view clearly, you don't apologize for having a position, you don't hedge your bets unnecessarily. You can be assertive without being certain. Some people sound confident while barely believing what they're saying at all. Assertiveness is about how clearly you speak or act. Let's put this together and think about what patients actually experience. High certainty with low assertiveness. That's quiet confidence. The doctor knows what they're doing, but doesn't need to dominate the room. Patients often feel calm and secure here, even when very little is said. Next, we have low certainty with high assertiveness, and that's confidence without conviction. The words are clear, but the internal trust isn't there. And patients often sense a mismatch here, even though they can't explain why. Next, high certainty with high assertiveness. Now that is authority. Clear thinking, clear language, and a plan that feels really solid and held together tight. The patients feel guided and don't feel pushed into anything in this situation. And next we have low certainty with low assertiveness. That's hesitation. You're overqualifying things, you're over-explaining, there's long pauses. Patients pick up on this all the time. They pick up immediately, and it often increases their anxiety or their uncertainty. Confidence is strongest when the inner trust and outer clarity line up. Certainty asks, do I believe this is true? Assertiveness asks, am I willing to say this clearly? But confidence asks, do I trust myself here? That's why some people can sound confident without actually being confident, and why some genuinely confident doctors don't need to dominate conversations or over-explain themselves. Once you see this, 3 common mistakes become obvious. The first is confusing humility with self-doubt. Humility is being honest about uncertainty. Self-doubt is apologizing for your professional judgments. Patients don't need certainty, they need clarity. The second mistake is underestimating follow-through. Confidence doesn't come from knowledge alone, it comes from repeatedly doing what you said you would do. And the third mistake is waiting to feel confident before acting or starting. That works in almost no area of medicine or life for that matter. Confidence isn't something you wait for, it's what you become when your thoughts, your words, and your actions stop contradicting each other. You decide clearly, you speak assertively, and you follow through and do what you said. You don't need to be perfect, you just need to do it consistently. Confidence doesn't come from knowing all the answers, but it does come from trusting how you'll respond when you don't.